Question 1. During a discrete trial training, DTT, session, the RBT presents an instruction, SD, waits for the client's response, and then provides a consequence. What is the very first step in this sequence? A. Providing reinforcement. B. Presenting the instruction, SD. C. Recording the data. D. Waiting for the client's response. Answer. B. Presenting the instruction, SD. This question tests your understanding of the basic structure of discrete trial training, DTT. The keyword here is first step. DTT follows a distinct pattern, SD, instruction, greater than response, greater than consequence. Therefore, the very first thing you do in a single trial is give the instruction, also known as the discriminative stimulus, or SD. For instance, you might say, touch red, the SD, then the child touches the red card, response, and then you say, great job. Consequence, remember this simple flow, instruction first, then the behavior, then what happens after. Question 2. An RBT is working with a child in their home. The child's neighbor asks the RBT how the sessions are going. What should the RBT do? A. Briefly explain the child's progress. B. Say, he's doing fine, and change the subject. C. Explain that they cannot share any information about the client due to confidentiality rules. D. Invite the neighbor in to observe a small part of the session. Answer. C. Explain that they cannot share any information about the client due to confidentiality rules. This question focuses on the critical ethical principle of confidentiality. The clue is that someone outside the treatment team, the neighbor, is asking about the client. RBTs have a strict duty to protect client privacy, which means not sharing any identifying information or details about their treatment or progress with unauthorized individuals. Simply saying he's doing fine still confirms you work with the child, which can be a breach. Sharing details or allowing observation is definitely not allowed. For example, even confirming you work with a specific child as someone like a neighbor violates privacy. Your go-to response should always be to politely state you can't discuss your clients due to confidentiality. Question 3. If an RBT is asked to record how many times a client raises their hand during a 30-minute class period, what type of measurement are they using? A. Duration. B. Latency. C. Frequency. D. Interval recording. Answer. C. Frequency. This question is about choosing the right measurement method, specifically looking at counting behavior occurrences. The key phrase is how many times. Frequency recording is simply counting how often a specific behavior happens within a set observation time. It doesn't measure how long the hand stays up, that would be duration, or how long it takes to raise the hand after a question, latency, or if it happened during certain time blocks, interval recording. For example, if the client raised their hand 5 times during the 30 minutes, the frequency is 5. So, think frequency equals count. Question 4. A child often screams to get attention from their parents. The parents and the RBT decide to completely ignore the screaming, providing no reaction or attention when it occurs. What behavior reduction technique are they likely using? A. Positive punishment. B. Negative reinforcement. C. Extinction. D. Shaping. Answer. C. Extinction. This question asks you to identify a behavior reduction strategy based on withholding reinforcement. The key clue is that they completely ignore the screaming and provide no reaction or attention. Extinction works by removing the reinforcement that was previously maintaining a behavior. In this case, the attention was likely reinforcing the screaming, so removing the attention aims to decrease the screaming over time. It's not punishment, adding or removing something to decrease behavior immediately, or reinforcement, increasing behavior, or shaping, teaching a new skill. For instance, if a child previously got juice by whining, and now whining never results in juice, that's extinction for whining. Remember, extinction means stopping the payoff for the behavior. Question 5. An RBT offers a client a choice between playing with blocks or drawing with crayons, and records which one the client picks. The RBT repeats this with different pairs of items. What procedure is the RBT conducting? A. Functional Behavior Assessment, FBA. B. Paired Stimulus Preference Assessment. C. Task Analysis. D. Discrete Trial Training, DTT. Answer: B. Paired Stimulus Preference Assessment. This question tests your knowledge of specific types of preference assessments. The keywords are choice between, pairs of items, and records which one the client picks. A paired stimulus preference assessment involves presenting 2 items at a time and asking the client to choose one. This helps identify which items the client prefers when given options, ranking them based on how often they are chosen. It's different from an FBA. Analyzing why behavior happens, a task analysis, breaking down the skill, or DTT, a teaching method. Think paired means 2 items presented together for a choice. Question 6. When teaching a client to tie their shoes, the RBT guides the client's hands through the steps. What is this type of assistance called? A. Reinforcement. B. Prompting. C. Fading. D. Shaping. Answer: B. Prompting. The concept here is providing help to ensure a correct response during learning. The key phrase is guides the client's hands. Prompting involves giving cues or assistance to encourage the client to perform the desired behavior correctly. Guiding hands is a type of physical prompt. Other prompts could be verbal hints, gestures, or showing the client what to do, modeling. Reinforcement happens after the behavior, fading is gradually removing prompts, and shaping is reinforcing successive approximations. So when you're actively helping someone perform the skill, that's prompting. Think of prompts as helpful hints or assists. Question 7. When writing session notes, what is the most important characteristic they should have? A. Include personal opinions about the client's mood. B. Be written in technical ABA jargon. C. Be subjective and interpretive. D. Be objective and based on observable events. Answer: D. Be objective and based on observable events. This question focuses on the requirements for good documentation, specifically session notes. The keyword is most important characteristic. Session notes must be objective, meaning they describe only what was actually seen or heard, not feelings, guesses, or interpretations. Using jargon isn't helpful if others can't understand it, and personal opinions or subjective descriptions, like the client seemed angry, are not professional or measurable. For example, instead of writing Leo was frustrated, you'd write Leo threw the blocks and furrowed his brow. Stick to the facts, just describe what you saw and heard. Question 8. A client frequently bangs their head on the floor when they are left alone with no toys or activities. What is the most likely function of this behavior? A. Attention. B. Escape/avoidance. C. Access to tangibles. D. Automatic reinforcement. Sensory. Answer: D. Automatic reinforcement. Sensory. This question asks you to identify the likely function, the reason, or purpose of a behavior based on the context. The important clues are that the behavior happens when the client is left alone and has no toys or activities. This suggests the behavior isn't done to get attention from others, escape a task, or get a specific item. Automatic reinforcement, often called sensory stimulation, means the behavior itself feels good or relieves discomfort, regardless of the external environment or other people. Head banging might provide some kind of internal sensory input that the client seeks when understimulated. Always look at when the behavior occurs to figure out why. Question 9. An RBT is measuring how long it takes for a client to complete a puzzle after being told, finish the puzzle. What type of measurement is this? A. Frequency. B. Latency. C. Duration. D. Interresponse time. IRT. Answer C. Duration. This question tests your ability to identify different continuous measurement types. The key phrase is how long it takes for a client to complete the task, meaning the total time the behavior itself lasts from start to finish. Duration measures the length of time a behavior occurs. It's not frequency. How many times? Latency, time from instruction to start of behavior, or IRT, time between two instances of the same behavior. For example, if the client started the puzzle immediately and it took them 5 minutes to finish, the duration is 5 minutes. Think duration equals how long. Question 10. What is the primary role of the RBT supervisor, BCBA or BCBA? A. To provide direct therapy to the client instead of the RBT. B. To handle billing and scheduling only. C. To provide ongoing training, support, and clinical guidance to the RBT. D. To be friends with the RBT and client's family. Answer C. To provide ongoing training, support, and clinical guidance to the RBT. This question is about the relationship between an RBT and their supervisor, a core aspect of professional conduct. The keyword is primary role. While supervisors handle various tasks, their main responsibility regarding the RBT is ensuring the RBT implements treatment plans correctly and ethically. This involves regular supervision meetings, providing feedback, training on new procedures, and being available for clinical questions. They aren't there just for admin tasks or to be social friends. Their focus is on the quality and effectiveness of the ABA services provided via the RBT. Your supervisor is your guide for implementing the treatment plan correctly and ethically. Question 11. An RBT is teaching a child to say bubble. First, the RBT reinforces the child for making a B sound. Then they only reinforce bub. And finally, only reinforce the full word bubble. What teaching strategy is being used? A. Chaining. B. Discrete trial training, DTT. C. Shaping. D. Prompt fading. Answer C. Shaping. This question describes a specific teaching technique for developing new behaviors. The key idea is reinforcing successive approximations, steps that get closer and closer to the final target behavior. Shaping involves reinforcing small improvements or attempts until the full behavior is learned. It's not chaining, linking already known steps, DTT, a specific trial format, or prompt fading, reducing help. Think of shaping like sculpting. You start with a rough form, B, and gradually refine it, bub, until you reach the final masterpiece, bubble. Shaping helps build new behaviors bit by bit. Question 12. Which of the following describes reinforcement? A. A process that weakens or decreases a behavior. B. A consequence that is added after a behavior occurs. C. A consequence presented after a behavior that increases the likelihood of that behavior occurring in the future. D. Ignoring a behavior completely until it stops. Answer C. A consequence presented after a behavior that increases the likelihood of that behavior occurring in the future. This question asks for the fundamental definition of reinforcement. The crucial part of the definition is that reinforcement increases the future likelihood of the behavior it follows. Option A. Describes punishment. Option B. Only describes positive reinforcement or positive punishment, adding something but misses the effect on behavior. Option D. Describes extinction. Reinforcement is all about making a behavior happen more often in the future by providing a desirable consequence right after it occurs. For example, giving praise, consequence. After a child shares a toy, behavior, makes them more likely to share again. Remember, reinforcement strengthens behavior. Question 13. An RBT is observing a client for 10 minutes, divided into 1-minute intervals. The RBT marks the interval if the target behavior, example, hand flapping, occurs at any point during that 1-minute interval. What type of discontinuous measurement is this? A. Whole interval recording. B. Momentary time sampling. C. partial interval recording. D. Frequency recording. Answer: C. Partial interval recording. This question tests your knowledge of discontinuous measurement systems. The key phrase is occurs at any point during that interval. Partial interval recording involves checking off an interval if the behavior happened at least once during that time block. It doesn't matter how many times it happened or for how long, just that it occurred. This method tends to overestimate behavior occurrence. It differs from whole interval. Behavior must occur for the entire interval, and momentary time sampling. Behavior must occur at the exact moment the interval ends. Think partial equals happened at any part of the interval. Question 14. An RBT needs to teach a client how to brush their teeth. The supervising BCBA provides the RBT with a list of steps. Get toothbrush, wet toothbrush, put on toothpaste, etc. What is this list of steps called? A. Preference assessment. B. Behavior intervention plan. BAP. C. Task analysis. D. Data sheet. Answer: C. Task analysis. The concept here is breaking down complex skills into smaller, teachable steps. The clue is the list of steps for a specific skill, like brush their teeth. A task analysis is the process of breaking down a complex behavior chain into a sequence of smaller, individual steps. This makes teaching complex skills like hygiene routines, cooking, or academic tasks much more manageable. It's not a preference assessment, finding likes, a BIP. Plan for reducing problem behavior, or just a data sheet for recording. Think of a task analysis as a recipe for teaching a skill. Question 15. An RBT realizes their neighbor is the parent of a new client assigned to them. Why might this situation be an ethical concern? A. It guarantees the RBT will provide better service. B. It represents a potential dual relationship, which could impair objectivity. C. It helps the RBT gather more information about the client. D. It is required for RBTs to work within their own neighborhood. Answer: B. It represents a potential dual relationship, which could impair objectivity. This question relates to RBT ethics, specifically professional boundaries. The keyword is dual relationship, which occurs when an RBT has another connection, like neighbor, friend, family member, with a client or their family outside of the professional therapist-client relationship. These situations can compromise the RBT's objectivity, decision-making, and ability to maintain professional boundaries, potentially leading to conflicts of interest or biased treatment. While it might seem convenient, ethics codes strongly discourage dual relationships to protect the client and the integrity of the services. Always keep professional and personal lives separate when it comes to clients. Question 16. Before a client starts difficult homework, the RBT reminds them they can ask for a short break by raising their hand. This reminder helps prevent the client from ripping their paper, which they sometimes do when frustrated. What type of strategy is this reminder? A. Consequence intervention. B. Extinction procedure. C. Antecedent intervention. D. Punishment procedure. Answer: C. Antecedent intervention. This question asks you to classify a strategy based on when it occurs relative to the behavior. The key is that the reminder happens before a client starts difficult homework to prevent the paper ripping. Antecedent interventions are strategies implemented before a behavior is likely to occur, designed to prevent problem behavior or trigger desired behavior. Modifying the environment, providing choices, or giving reminders like this are all antecedent strategies. Consequence interventions, like reinforcement or punishment, happen after the behavior. Extinction involves withholding reinforcement. This reminder changes the situation beforehand to make the problem behavior less likely. Think antecedent equals before. Question 17. What is the primary purpose of conducting a functional behavior assessment, FBA? A. To teach the client new replacement skills. B. To determine the likely reason, function, why a problem behavior is occurring. C. To choose potential reinforcers for the client. D. To directly punish the problem behavior. Answer B. To determine the likely reason, function, why a problem behavior is occurring. This question asks about the core goal of a functional behavior assessment, FBA. The key phrase is primary purpose. An FBA is a systematic process used to understand why a client engages in a specific challenging behavior by identifying the function, the purpose the behavior serves for the individual, such as getting attention, escaping a task, accessing something preferred, or automatic/sensory reasons, while an FBA informs teach and replacement skills, A, and choosing reinforcers, C. Its main goal is hypothesis generation about the function. It is definitely not used to directly punish behavior, D. Think FBA equals finding the function, the why. Question 18. A client learns to ask for juice at the clinic table with their RBT. Later, the client asks for juice at home with their parents and at school with their teacher. What behavioral principle does this demonstrate? A. Shaping. B. Maintenance. C. Generalization. D. Extinction. Answer C. Generalization. This question describes a behavior occurring in different contexts after being learned in one specific context. The clue is the skill, asking for juice, spreading from the clinic table with their RBT to at home with parents and at school with teacher. Generalization is when a learned behavior occurs in environments, or with people, or with materials different from those used during teaching. It's a crucial goal of ABA. We want skills to be useful in the client's everyday life, not just during therapy sessions. It's not shaping, building approximations, maintenance, keeping the skill over time after teaching stops, or extinction, behavior decreasing. Think generalization equals skill spreading to new situations. Question 19. An RBT says, clap your hands, and starts a timer. They stop the timer as soon as the client begins to clap. What is the RBT measuring? A. Duration. B. Frequency. C. Inter-response time, IRT. D. Latency. Answer D. Latency. This question tests your understanding of measuring the time before a behavior starts. The key is measuring the time from the instruction, clap your hands, until the client begins to clap. Latency is the measure of time between the presentation of a stimulus, like an instruction or SD, and the initiation of the response. It's different from duration, how long the clapping lasts, frequency, how many times they clap, or IRT, time between claps. Think latency equals time it takes to get started. Question 20. An RBT notices that a client seems unusually tired and sluggish during sessions shortly after starting a new medication prescribed by their doctor. What should the RBT do? A. Recommend the parents stop the medication immediately. B. Ignore the change as it's not related to behavior. C. Document the observation objectively and report it to their supervisor. D. Ask the client's parents about the medication's side effects directly. Answer C. Document the observation objectively and report it to their supervisor. This question deals with professional responsibilities regarding documentation and communication. The clue is observing a significant change, unusually tired and sluggish, potentially linked to an outside variable, new medication. RBTs must document and report variables that might affect the client's behavior or performance in sessions to their supervisor. It is outside the RBT's scope of practice to give medical advice. A. Ignoring significant changes is inappropriate. B. While parents might be informed, the primary communication channel for clinical concerns is reporting to the supervisor, who can then coordinate with parents or others as needed. It relates to C, but C is the direct action required by the RBT. Your job is to observe, record, and report important changes to your supervisor. Question 21. A client often shouts out answers in class instead of raising their hand. The teacher decides to praise the client, specifically when they raise their hand, and ignores them when they shout out. This strategy, where reinforcement is given for a desired behavior while reinforcement is withheld for an undesired behavior, is called A. Positive punishment. B. Differential reinforcement of alternative behavior. DRA. C. Extinction burst. D. Negative reinforcement. Answer B. Differential reinforcement of alternative behavior. DRA. This question describes a specific type of differential reinforcement. The key elements are reinforcing a specific alternative behavior, raising hand, and putting the problem behavior, shouting out, on extinction, ignoring. Differential reinforcement of alternative behavior, DRA, involves reinforcing a behavior that serves as a desirable substitute for the problem behavior. It's not punishment, decreasing behavior, an extinction burst, temporary increase in behavior during extinction, or negative reinforcement, removing something unpleasant to increase behavior. Think DRI equals reinforce the replacement behavior. Question 22. An RBT is teaching a child to request a toy car by waiting for the child to show interest in the car during playtime, then prompting them to say car before giving it to them. What teaching method does this best describe? A. Discrete trial training, DTT. B. Task analysis. C. Naturalistic environmental teaching, NET. D. Shaping. Answer C. Naturalistic environmental teaching, NET. This question asks you to identify a teaching approach based on the setting and context. The clues are teaching during playtime, waiting for the child to show interest, and using naturally occurring motivation. Naturalistic environmental teaching, NET, sometimes called incidental teaching, involves teaching skills within the ongoing natural environment and activities, capitalizing on the learner's motivation. It contrasts with the highly structured format of DTT. It's not task analysis, breaking down skills, or shaping, reinforcing approximations. NET uses real-life situations to teach skills, making learning more functional. Think NET equals teaching in the natural setting. Question 23. An RBT makes sure to always speak respectfully to the client, allows them choices when appropriate, and ensures their personal space is respected. Which ethical principle is the RBT demonstrating? A. Maintaining confidentiality. B. Maintaining professional boundaries. C. Maintaining client dignity. D. Competence and service delivery. Answer C. Maintain client dignity. This question focuses on ethical conduct related to how clients are treated. The keywords speak respectfully, allows choices, and personal space is respected all point towards treating the client with respect and ensuring their comfort and rights are upheld. Maintaining client dignity is a fundamental ethical obligation, ensuring that clients are treated as individuals worthy of respect throughout the service delivery process. While confidentiality and boundaries are also important ethical rules, these specific actions directly relate to upholding the client's dignity. Always treat your clients with the respect you would want for yourself or a loved one. Question 24. An RBT is observing a client for nail biting during a 10-minute period, divided into 30-second intervals. The RBT records if nail biting occurred for the entire 30-second interval. What measurement procedure is this? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Latency recording. Answer B. Whole interval recording. This question tests your knowledge of another discontinuous measurement system. The critical phrase here is recording if the behavior occurred for the entire interval. Whole interval recording requires the behavior to be ongoing throughout the whole observation interval to be marked as an occurrence. If the behavior stops at any point during the interval, it's not recorded for that interval. This method often underestimates the occurrence of behavior. It's different from partial interval, occurs at any time, and momentary time sampling occurs at the end of the interval. Think whole equals happen for the whole time block. Question 25. After successfully teaching a client to wash their hands independently using prompts and reinforcement, The RBT slowly stops providing praise every time, but checks periodically to ensure the skill is still being performed correctly weeks later. What is the RBT assessing? A. Generalization. B. Shaping. C. Maintenance. D. Preference. Answer C. Maintenance. This question asks about ensuring skills persist over time after active teaching has reduced or stopped. The key clues are after successfully teaching, stops providing praise every time, and checking weeks later if the skill is still being performed correctly. Maintenance refers to the extent to which a learner continues to perform a target behavior after a portion or all of the intervention responsible for the behavior change has been removed. It's about making sure the skill sticks long-term. It differs from generalization, skill spreading to new settings/people, shaping, teaching approximations, or preference, finding likes. Think maintenance equals maintaining the skill over time.